Turning to the coronavirus, millions of Americans are now eligible for COVID booster shots after the Centers for Disease Control and Prevention widened the pool of eligibility on Friday. Anyone 18 or older can now get a third shot 6 months after their last dose of a Pfizer or Moderna vaccine, or 2 months past the single-dose Johnson & Johnson vaccine. It comes as the average number of COVID cases in the nation is up 24% since November 4th. Elise Preston is here with the story. Elise, good morning.
Good morning. Across the country, governors and health officials are bracing as they try to avert a winter surge of coronavirus cases. The cold weather and upcoming holidays when people gather indoors could fuel high caseloads like ones we are already seeing in some states.
The unvaccinated have swelled Minnesota ICU beds to capacity. More than 3,000 COVID patients are hospitalized in Michigan, a number not seen since the spring. They are among 4 upper Midwest states with the highest rates of new COVID cases.
The message has to be loud and clear. You can't run out the game clock on this one. This virus will find you.
As travelers start heading home for Thanksgiving, health officials hope booster shots will help those already vaccinated avoid getting sick.
If you're one of the approximately 100 million people in this country already eligible for a booster, our recommendation is that you get the extra protection afforded by a booster as soon as possible.
3 out of every 10 Americans remain unvaccinated. Philadelphia yesterday became the latest big city to mandate vaccinations for its 26,000 employees, joining a dozen others, including Los Angeles and Chicago. Other cities are tempering mandates by allowing regular testing for unvaccinated workers instead, and some places are going to court. Watching the backlash is Professor Allison Hoffman, who writes about healthcare law and policy at the University of Pennsylvania.
And going back 116 years to 1905, a case called Jacobson versus Massachusetts, the court said that that in cases where there is a public health need, that states and localities can put public health measures into place. And so things like vaccination mandates and other public health measures have a long history.
Meanwhile, 2 new studies reveal the risk COVID presents to pregnant women. One shows the risk of death is more than 3 times higher in COVID-positive pregnant women. Another study found the risk of stillbirths increased by 90%. Only about 35% of pregnant women are vaccinated. The CDC recommends the vaccine for pregnant women. Jeff?
Elise, thank you very much.